This is an informational video by the law offices of Miller and Zois. This video will teach you about pain pumps, the current status of the lawsuits around the country, the careless and negligent behavior of the manufacturers, the diagnosis and prognosis of patients who have been injured by pain pumps, and we'll also tell you what you can do in case you've been hurt by one of these medical devices. There have been over 115 individual pain pump cases filed across the country. It's important to note that these are not class action lawsuits. Rather, every individual who is injured by a pain pump has their own lawsuit filed in a state or federal court system. Some of these cases have been settled, and more are being settled every day. Most cases are in the discovery and expert discovery phases, though new cases are being filed regularly. Pain pumps are small devices about the size of cell phones which are used to relieve post-surgical pain. They have frequently been used after such operations as cesarean sections, breast augmentation or reduction, hysterectomies, and gastric bypass. Until recently, they were frequently used following shoulder surgeries. Pain pumps contain a local anesthetic, like a Marcaine or bupivacaine, and continually inject that drug through a tube known as a catheter to the surgical site for around 48 hours, sometimes between 12 hours, lasting up to 5 days. When the pain pump is emptied, the patient or his or her doctor removes the catheter and disposes of the pain pump. Most pain pumps are one-time use only. Pain pumps are dangerous in a certain way. They're not defective per se, but they do fail in the terms of lack of warnings. Pain pumps, when used inappropriately the way they've been marketed, cause death to the shoulder cartilage cells known as chondrocytes. The anesthetic in the pump is chondrotoxic, which means that it's harmful to the cartilage cells. Patients injured by pain pumps develop a condition called chondrolysis, also known as chondrolysis, which is the complete or nearly complete loss of cartilage in the shoulder joint. Without that cartilage, the patient's bone from the arm rubs against the socket bone, creating a bone-on-bone condition, which grinds away at the bone and wears it down. Shoulder chondrolysis is irreversible, disabling, and extremely painful. Patients who suffer from this condition will typically require additional surgeries, including complete shoulder joint replacement. The symptoms for shoulder chondrolysis include decreased range of motion, stiffness, popping, and weakness. Most of our clients report difficulty sleeping or even sitting in a restful position. In order to determine whether you have shoulder chondrolysis, there are three methods to use. The first is surgery. If you have a surgery after the insertion of the pump, your surgeon can examine the state of your glenohumeral joint to determine whether you have loss of cartilage. The second way is through X-rays. X-rays taken after the insertion of the pain pump may reveal a lack of space in the glenohumeral joint. That lack of space on a properly performed X-ray typically indicates lack of cartilage. The third way to determine if a pain pump caused chondrolysis is through MRIs. An MRI taken after the insertion of a pain pump may reveal that cartilage is eroded, as is indicated in the diagram here. Cartilage erosion is a progressive condition. Diagnostic tests such as the X-ray or the MRI, which are performed less than 16 months after surgery, should be repeated at that time if they were previously inconclusive. As indicated here, cartilage damage, in order for it to fully manifest, can take anywhere from 3 to 16 months. The various manufacturers of the pain pumps and the distributors of the pain pumps are as follows: DonJoy, iFlow On-Q on the upper right-hand corner, which currently has the largest market share of the pain pump market, Stryker on the bottom left, and Stryker Pain Pump 2 on the bottom right. Other manufacturers and distributors include Scarlato, Breg, McKinley, which is working with Curlin, and Ace Medical Infuser. Manufacturers knew or should have known that pain pumps were dangerous for some time. In 1998 and 1999, one of the main manufacturers of pain pumps, iFlow, was rejected 3 times by the Federal Food and Drug Administration for intra-articular use of the pain pump and for use in the synovial cavity. The FDA rejected those uses as approved indications because iFlow did not provide any safety data indicating that the pumps were okay to be used in those places. From 2002 to 2004, despite iFlow's knowledge that they had been turned down by the FDA, iFlow continued to market these pumps for orthopedic and intra-articular use. During that time, iFlow was involved in dozens of studies, and yet they refused to sponsor any studies to look at the safety of inserting the pain pump catheter into the intra-articular cavity, which is where the joint is. Other manufacturers likewise continued to market these pumps for shoulder surgery. On July 27th of 2004, iFlow was placed on notice of 8 young patients of a Birmingham doctor who had instability repairs where pain pumps were used. After use of those pain pumps, those patients subsequently developed chondrolysis, or loss of shoulder cartilage. iFlow, however, refused to investigate. During this time period, around 2000, iFlow and the other manufacturers and distributors really marketed their pain pumps to doctors for use in the shoulder. Doctors had the right to rely on the pain pump manufacturers and distributors, as they were in a better position to know of the benefits and safety aspects and risks of their devices. iFlow has since stopped openly marketing their pumps for shoulder surgeries. The public, on the other hand, did not find out that pain pumps were dangerous until the advent of a medical journal article in the American Journal of Sports Medicine called Post-Arthroscopic Glenohumeral Chondrolysis. This article, published online on July 3, 2007, was really the first indication in the medical community that there was a potential problem with pain pumps. This article, written by doctors Brett Hansen and Charles Beck, concluded that the use of intra-articular pain pumps using bupivacaine with epinephrine appeared to be highly associated with post-arthroscopic glenohumeral chondrolysis. Post-arthroscopic is simply a fancy word to mean after arthroscopic, which is the type of shoulder surgery frequently used before pain pumps. Essentially, it involves the creation of a small incision in the shoulder through which medical tools are put into in order to complete the surgery. It's different from an open shoulder surgery, which involves a larger incision. The article indicated that there was a concerning and strong association between pain pumps and chondrolysis of the shoulder. In the article, the authors recommended that the use of the intra-articular pain pump catheters in combination with bupivacaine, with or without epinephrine, be avoided in all joints with an intact cartilage surface. Since that article, other medical studies have been performed which indicate that epinephrine is not a significant problem. However, the marcaines, lidocaines, bupivacaines, and ropivacaines are a significant problem and chondrotoxic. The prognosis for patients who have had pain pumps and suffer from shoulder chondrolysis is grim. Patients frequently require what's called a shoulder replacement surgery, which is the insertion of hardware into the shoulder, into the arm bone and into the shoulder. The top of the humeral head, the arm bone, is lopped off surgically, and a plastic or metal cup is fitted over that. These shoulder replacement surgeries have a limited lifespan, ranging from about 10 to 15 years. This makes these surgeries especially difficult for the young, who can not have as many shoulder replacement surgeries as older patients, because there's only so much raw material to work with. Each surgery lessens the ability of a surgeon to do another replacement surgery. Shoulder replacement surgeries, furthermore, are meant to address pain only. They do not necessarily increase a patient's range of motion. Some doctors are experimenting right now with cartilage replacement surgery. However, those surgeries are experimental at this time and not widely used. In order to determine whether you can file a lawsuit, please contact the law offices of Miller & Zoyce at 1-800-553-8082. We have attorneys licensed in Maryland, the District of Columbia, Pennsylvania, Georgia, and Minnesota. Additionally, we're permitted to practice in other courts by special permission of the judge. For more information, please visit our website at www.millerandzoyce.com. Thank you.